Welcome back, dear friends. This is the continuation of the treatment carried out to save an innocent young elephant who was a victim of both a gunshot and a snare trap. As per our promise, to protect and save every life until full recovery, the team of wildlife conservation officers and veterinary officials carried out a second treatment session for the elephant we treated a few days ago. There is a reminder for you. If you have not yet watched the previous video on treating this elephant, make sure you watch it. We have pinned the video in the first comment. The veterinary lady doctor examined the leg more closely and noticed that the swelling and infection in the leg had reduced. According to her, the previous treatment session had already set the wound on a path toward healing. The veterinary doctor decides to sedate the animal as the very first step in the treatment procedure. So, a mild dosage of the anesthetic drug was darted to the elephant intramuscularly using a tranquilizer gun. Now, once the elephant is sedated after about 15 minutes, the necessary dosages of antibiotics, multivitamins, painkillers, and anti-inflammatory drugs are administered intramuscularly. At the same time, another officer started treating the gunshot wound. Based on the majority of our viewers' requests, we have added the step-by-step procedure of treating the wound on the elephant to the video. This wound treatment procedure is shown purely for educational purposes and to help raise awareness about wildlife rescue efforts and veterinary care. At first, the wound was cleaned using saline solution and cotton wool. This process will remove the maggots, pus, necrotic tissue, or any bullet particles lodged within the wound. Then, a disinfectant solution is used to clean the wound. A syringe was used to inject it. The officer used forceps and cotton wool to clean the wounded area more deeply. This was the result of a gunshot. Usually, the elephants treated for such horrific injuries roam far from the area, but fortunately, this elephant had stayed nearby. This made it easier for the ranger officer to locate the unfortunate creature. He quickly notified wildlife conservation officials of its location, stating that it was the ideal time to continue the treatment. So, the wildlife conservation officials and the veterinary team had to pass the same challenging path to reach the injured elephant. To get there, they bravely crossed a massive fallen tree that stretched across a river. This was the same path they followed in their previous treatment mission. They passed through all these obstacles to save the life of a poor creature. Their dedication goes far beyond what most of us can imagine. Let's get back to the wound treatment procedure. Now a syringe is used to inject a solution of povidone iodine and negasunt powder into the wound. The same treatment procedure was carried out to treat the wound on the other side of the leg. These poor animals endure severe pain. Despite their inability to convey their feelings verbally, their aggressive behavior, body language, and daily movements clearly show that they are suffering. In many cases, these giants walk into the forest with gunshot wounds that cause them excruciating pain. Gunshot wounds can grow and get deeply infected over time, causing massive abscesses. Then they leave their herds to live alone because they are unable to move around with their herd or obtain food from their regular sources. That is why identifying the individuals responsible for such cruel acts is so challenging. Luckily, this elephant was found at the perfect time, so that this treatment process could result in a quick recovery. As the final step to treat the wound, the anti-fly spray is sprayed on the treated wound and the injection sites. A ranger officer was allocated to monitor the progress of this elephant. We can see significant improvement in the leg wound compared to the previous treatment. The veterinarian believes that with 1 or 2 follow-up treatments, the elephant is likely to make a full recovery. Now that the treatment process is completed, the revival drug was injected through a major ear vein. That has brought us to the end of this treatment mission. We would like to thank all of our viewers, the veterinary doctor, veterinary officials, wildlife conservation officials, the villagers who were involved in this mission, the woodcutter who initially informed us about the poor elephant at the correct time, and all the others who were involved.
हाँ apa dia mama dia ni kam bisa lagi ya